So we have an attractive young man who wants to have a very chiseled type of face. And over the last, how long have we known each other? For a few years now,
Yeah.
right? We have been working on the cheeks. I'm not a fan of doing too much in one shot, so we do little by little. We've created really nice defined chiseled cheekbones for him. Today we're gonna add a little bit to the jawline to kind of augment that and give him that really nice chiseled defined face. A couple of spot treatments around other places, but we're using Voluma here. Now, I always tell patients when we do this area, there's always a risk of issues with the parotid gland. There's risk of infection and fistula formation. We prep the face fully, but there's really no way of doing anything to the face, even surgically sterile, because the mouth and nose are around that area. Luckily, the face has good blood flow, good vascularity, and infections are very rare, but something to be aware of. So we're gonna do some injections right there. So you'll watch the technique. You know that my technique usually is serial puncture with micro droplets. These are gonna be a little bit larger droplets because you need more volume there. But I don't like serial threading because I don't want stuff underneath the skin. Doesn't make sense to have filler with a long needle with a cannula underneath the skin. This needs to be same as this, on top of the bone, on top of the muscle, pushing it out. So we're gonna start right there. You ready?
Mm-hmm.
Injections are deep and then they basically fill out. And it's just creating more definition to the angle of the mandible, to the ramus. If you need a break, let me know. Good. The filler is Voluma, and the Voluma has lidocaine with it. There are angular mandible implants. Implant Tech has them, but again, a risky procedure in this area, risk of nerve damage. The filler is a better option. Now, the grass is always greener on the other side. There are plenty of patients that have very full mandibles and they don't like it. So they come in and we do Botox to basically the same exact area to thin out and cause atrophy of their masseter muscle. A lot of women come in asking for a more defined jawline. While you can get the definition from the profile, you have to be aware that it does give you more width from the front view. For men, it's a nice look. For women, you have to balance the front and the side together. You don't want to have a very defined side view and then have a very widened front view. So these are serial injections, building little columns. Augments this area nicely, defines the jawline. I'm going to walk it up the ramus of the mandible. Anytime you add volume to the face, you're also improving skin laxity. As we get older, we lose some volume and the skin loosens up a little bit, but as we do this, it basically fills out the skin nicely. Fairly comfortable?
Yeah.
Okay. The massaging is very gentle. I'm putting the fillers where they need to go. I'm not overfilling any area. So I don't need to sit down and beat up the face and massage it too much afterwards. So that's 1 cc. And if you back up a little bit, you can kind of see how it filled up in this area compared to the way we started out before. There's really no bruising at all, a little bit of swelling. Now, the filler, 1 syringe, 1 cc is only 1/5 of a teaspoon. FDA trials, for example, for the mid-face, they were doing 7 to 14 syringes of filler to the mid-face. We've never done more than, a couple at a time. I am more a fan of do little by little by little by little to build it up, but not so little that you don't see a difference. So we're gonna add a couple more syringes, but then in about 4 to 6 months, we'll add a little bit more. That's basically the definition of the angle of the mandible. And it's a pretty common procedure amongst men today and some women. Thank you.